Hello and welcome. This is James Fitzgerald, the content administrator of this video. I would like to briefly discuss and introduce the concept of informed consent in relation to my services. Informed consent is a foundational ethical and legal requirement in mental health. It ensures clients are fully aware of the nature of the therapeutic relationship and the treatments they will receive. It is a process that promotes autonomy, fosters trust, and protects clients' rights. Informed consent is a collaborative process between a therapist and a client. In this process, the therapist provides comprehensive information about the therapy, and the client voluntarily agrees to participate. It encompasses understanding the therapeutic methods, potential risks and benefits, confidentiality limits, and other pertinent details that might influence the client's decision to engage in treatment. The informed consent for services represents a contract of trust between us. You may be seeking therapy to find help, but what does informed consent truly mean? It's more than just signing a document. It encompasses your mental capacity to understand the work we will do together, my therapeutic approach, the risks and benefits involved, your rights and responsibilities, the alternatives to therapy, and your freedom to choose to engage in my services. You have the right to know what to expect. This includes the boundaries we will navigate together and the confidentiality surrounding you like a warm blanket. You should feel safe, knowing that your vulnerability will be respected and not judged. As a licensed professional trained in helping individuals grow and heal, I hold the key to understanding the complexities of the human mind. If you possess the mental capacity, you have the ability to explore and map your own psychological landscape. However, it's important to recognize the risks involved, including the potential discomfort that may arise when delving into deeper layers of your psyche. Professional codes of ethics, such as those from the American Psychological Association and the National Association of Social Workers, mandate therapists obtain informed consent. This practice respects client autonomy and promotes transparency. Laws at federal and state levels often require informed consent to protect clients' rights. Failure to obtain proper consent can result in legal consequences, including malpractice claims. Informed consent is my commitment to walking this path with you step by step. At the outset, we will discuss the therapeutic process in a face-to-face conversation. This includes discussing the nature of therapy, theoretical approaches, and what you can expect. You will also sign an informed consent form that outlines all the critical information. It serves as a reference for you and a record of the consent process that occurred. I will then begin explaining key components, such as the purpose of therapy and clarifying the goals and expected outcomes. Next, I will describe treatment methods and the techniques and interventions that may be used. I will discuss potential discomforts, emotional challenges, and the benefits of therapy. I will outline what information will remain private and the legal exceptions to confidentiality, for example, threats of harm to self or others, and abuse reporting. I will provide information on session lengths, fees, cancellation policies, and communication methods. I will ensure you comprehend the information by encouraging questions and discussing concerns. I will ask you for a voluntary agreement. You will then be asked to sign the informed consent form indicating your voluntary participation. I will also sign the document acknowledging the completion of the consent process. Informed consent is not a one-time event. I will revisit consent when introducing new treatments, when there are changes in therapy, or if new risks emerge. There are special considerations for informed consent. When providing services to minors, obtaining consent from legal guardians is required, and I seek permission from minors to involve them in the decision-making process. I take extra steps for clients with diminished capacity to ensure understanding, which may include simplified explanations or involving legally authorized representatives. I will endeavor to remain aware of cultural factors affecting understanding and consent, using interpreters, or culturally appropriate materials when necessary. I'll explain concepts using jargon-free, straightforward language to enhance client understanding. I'll also provide brochures or diagrams that illustrate the therapeutic process. I will ask clients to paraphrase information to confirm understanding. I maintain records of the informed consent process, including signed forms and discussion notes. This documentation is essential for legal compliance and continuity of care. Obtaining informed consent is critical in establishing a therapeutic relationship built on trust and respect. It empowers clients by involving them in treatment decisions and safeguards their rights. Therapists are committed to ensuring that clients are fully informed and comfortable with the therapeutic journey ahead. I will continue to share my processes and policies in future videos. Thank you for watching, and I encourage you to congratulate yourself for taking this significant leap for your own well-being.